I'm Geoffrey Fong at the University of Waterloo. I'm a professor of psychology and public health sciences. I'm also a senior investigator at the Ontario Institute for Cancer Research. Our research is focusing on the #1 preventable cause of death and disease in Ontario, in Canada, and throughout the world, which is tobacco smoking. Tobacco smoking kills half to 2/3 of its regular users. And in Canada, in Ontario, smoking kills 16,000 people a year. In Canada, it's 48,000 a year. And globally, it's 7.1 million people a year, plus an additional 1.2 million people who die, non-smokers who die of secondhand smoke. This is by far the #1 preventable cause of death and disease in the world, and we are trying to understand the impact of policies designed to reduce smoking throughout the world. Our team, our research team, is conducting massive surveys in 31 countries throughout the world, over half of the world's population, over 2/3 of the world's tobacco users, on the impact of tobacco control policies like smoke-free laws, graphic warning labels, higher taxation, bans on advertising, promotion, and sponsorship. Our research on evaluating policies has led in a number of cases to other countries taking on implementing the policies that we have evaluated in the first country. So for example, Ireland, which was the first country to go entirely smoke-free in 2004, we evaluated the impact of that extraordinary tobacco control policy. I mean, the Irish pubs were going to be going smoke-free, and there was incredible controversy, and people said it wouldn't work, and so on. But we showed that after the policy was implemented in Ireland and the pubs were supposed to go smoke-free, smoking in the pubs went from 97% to 3% in 1 year, from the ceiling to the floor. So when we published that paper, even before we published that paper, I took those findings and presented them at a high-level meeting of ministers throughout Europe and presented those data. And that, along with other advocacy work, led to a lot of countries throughout Europe and throughout the world implementing that same law. In 2017 and 2018, implemented throughout the country, province by province, a ban on menthol in cigarettes. What menthol does is it smooths out the harsh smoke of tobacco. So that makes it easier to breathe in. It's easier for kids who are starting to smoke to get through the harshness and so on. And it also gives people the false sense that somehow these cigarettes, menthol cigarettes, somehow might be less harmful. It's all incorrect. We found that in Canada, after the menthol cigarette ban, an additional 7.5% of menthol smokers quit, above and beyond those of non-menthol smokers over that same period of time. We communicated this with the US Food and Drug Administration, the FDA, which is responsible for tobacco regulation in the United States. A much greater percentage of American smokers smoke menthols. In fact, 40% of them do. So when you apply, and we communicated to the FDA, when you apply the 7.5% extra quitting that we found in Canada and apply it to the menthol smokers in the US, we estimate that if the US FDA were to ban menthol cigarettes, that would lead to an additional 1.3 million smokers who would quit. So that's an example where we are informing other countries of what Canada did in this case to motivate them to move forward with their own menthol cigarette ban in this case. And indeed, the FDA is doing that. And in the next few months, we should hear about a proposed rule to ban menthol cigarettes in the United States. The ITC project is continuing to do its important work to evaluate these major policies, tobacco control policies. We also are examining the impact of these alternative products that have cropped up in the last few years, e-cigarettes, the newer heated tobacco products, and so on. We need to have an understanding of how they are used. We need to understand how they are used with respect to cigarettes. And we're doing that in a number of countries throughout the world. So that's in addition to our evaluation of the policies of the Framework Convention on Tobacco Control.